A small act of design can have a big impact, and that multiple small acts of design can create a movement. My name is Dina Sorensen. I'm a project designer at VMDO Architects, and I also collaborate with public health researchers from the University of Virginia and the University of Nebraska. Together, we worked on the Buckingham Primary and Elementary School, which is in Dillwyn, Virginia, a K-5 campus. The design and the public health aspects of that project are benefiting the teachers, the students, and the community as a whole. It also represents, I think, a new typology of practice. So bringing public health researchers into the design process, struggling and sharing and developing a common language, designing and co-creating ideas that were built and are being tested is a really compelling story for the profession moving forward. So the question was, how do we create a building, a place, a context that supports health literacy? And so between the environmental literacy and the health literacy, we use some of the mechanisms and strategies that we've used in previous schools, wayfinding and signage, teaching tools and prompts that go into the building as to complement the architecture. So what we found with the qualitative research is that students are picking up on those communication systems, whether it be the architecture itself and noticing the places and spaces they have to play, study, relax, eat. They're picking up on the scale of those spaces, that they're designed for them from a kid-centric perspective. And they're also picking up on the deep signals that are embedded in the communication system around these educational signage pieces and wonderful opportunities to learn about the school that they are in, and also opportunities to learn about how they can make a difference in their choices. So we're seeing a strong connection between what the building is saying and what these design features are communicating, and how students are interpreting that and using it to make choices and changes. And because students are so eager to learn and interact with their environments, I'm learning that design doesn't have to be a big infrastructural component. It can be something very small that makes a big difference. And the more we add to this collective agency of small acts of design, I believe we will create a movement toward health.